What I'm about to share with you could save you or a loved one's life. There are certain heart myths that mainstream medicine has been telling us for years, and they're simply not true. And even worse, could even be killing you. Here's one of the biggest ones you need to know about now. Now I'm going to reveal the heart disease miracle drugs you should avoid at all costs. Specifically, if you're taking cholesterol-lowering statin medications, I want you to pay extra close attention. Your cardiologist won't like it, but it may save your life. A recent analysis of the results of a 2002 study just confirmed what I've been saying for years. If you don't already have cardiovascular disease, statins will not help you live longer. So why are mainstream docs still handing them out like candy? I truly believe that most cardiologists would love to see statins in our drinking water. The truth is, you just don't need them, period. And their risks are not worth their potential benefits. This recent analysis just proves my point. To look at the data with fresh eyes, the researchers separated out a group of participants for further analysis. This group included people over 65 who had high cholesterol or high blood pressure, but did not have cardiovascular disease. And what the researchers found should be plastered in every cardiologist's office across the country. Not only did statins fail to decrease mortality in those taking them, they were actually associated with an increase in mortality in those over 75. It's important to note that the increased risk didn't reach levels of statistical significance, but still, considering what we already know about the risks of statins, which I'll talk about in a moment, this new data should raise concerns. Instead, the conventional medical community is tripping over itself to issue calls for caution in interpreting these new results. They simply can't or won't believe what the data tells them. They've been brainwashed into thinking statin medications are miracle drugs. So even when science tells them otherwise, they just keep burying their heads in the sand. And here's the point they keep coming back to. Even when trial after trial shows that statins don't prolong lives, they keep pointing out that the drugs reduce the risk of coronary artery disease. But who cares? Honestly, if something doesn't prolong your life or improve your quality of life, what's the point of taking it? Especially in this case, when that something, statins, comes with a laundry list of troubling side effects. Think muscle pain and weakness, memory loss and cognitive dysfunction, diabetes, weight gain, back pain, liver damage, insomnia, and cataracts. And that's far from a complete list. When prevention comes with this many risks, it's really not preventative at all. It's just an added problem. So I'll give you the same tip I give my patients who are diagnosed with cancer. I want you to ask yourself two questions. Will this treatment prolong my life? Will it improve my quality of life? If not, then why do it? Recently, I had a patient come in with a total cholesterol level of 111 milligrams per deciliter, which is insanely low. He'd been taking statins for some time, and I was shocked to find out that he was still taking them. Believe it or not, some doctor out there actually thought it was a good idea to continue statin treatment, despite having artificially depressed this patient's cholesterol to a dangerously low level, a level that research shows increases the risks of stroke, cancer, depression, and even death. Of course, I advised him to stop taking the drugs immediately. How he was even managing to function is still a mystery to me. But sadly, it's not the first time I've found myself in a situation like this. Not by a long shot. So let me be clear. There's no evidence proving the benefit of statins if you don't have a history of cardiovascular disease. And no, high cholesterol and high blood pressure do not count as cardiovascular disease. And even if you do have cardiovascular disease, if, for example, you've had a stent put in, a heart attack or stroke, or have been diagnosed with an arrhythmia or heart failure, chances are you can manage and even reverse your condition without dangerous medications. The bottom line here is that every current statin user or potential statin candidate needs to have a conversation with their physician. Don't be afraid to ask point blank whether or not you really need these drugs, or whether it's safe to stop if you're currently taking them. And if you have any reason whatsoever to doubt your doctor's judgment, I urge you to seek a second opinion from a new doctor who shares your values when it comes to effective disease prevention and treatment. As I've been saying for decades, the best way to beat heart disease is to eat right, keep moving, manage your weight, and supplement sensibly. And only use heavy-duty, potentially dangerous pharmaceuticals as a last resort.